everyone. I'm Frank Mallicoat. I'm an anchor reporter for KTVU Fox 2 here in the San Francisco Bay Area. My guest is the owner of Enviro-Master out of the Sacramento area. It's a commercial disinfectant and sanitizing and safety company. And just for fun, we're going to talk about public restrooms and COVID-19. They don't mix very well, apparently. Let's say hi to Harminder Simi. How are you, sir?
I'm very well, Frank. Thank you very much. Nice to have you and have this opportunity to talk to you.
Well, good to have you as well. Well, according to a survey, a lot of people are fearing the flush. I mean, a lot of times you can't even find a public bathroom that's open these days, but nearly half of Americans are just staying away from them completely. I think I know why, but tell us why.
So even before COVID, so let's just face it, the restroom is a place where we go and deposit waste. And studies show in the same way that we are required to wear masks because anything that's airborne, has a higher chance of getting infection across people. Think of the restroom or the toilet bowl that effectively sneezes as well. Every time it's flushed, you're getting all these droplets. So before COVID, the risk of getting something from a public restroom was high. With COVID, of course, that has a different impact because we're still working on vaccines and so on. So yes, people are right to be cautious, but it doesn't mean that you can't go into a restroom. You just got to take some precautions.
Exactly. I know from your survey as well, 1 out of 3 actually went into a public restroom and walked out. There's a cleanliness issues or just being afraid of whatever's in there. And 15% actually said they hold their breath when they go in there. I mean, that might be a little much, but some bathrooms are better than others, I guess, right?
For sure. And I mean, we can all examine our own personal behaviors, how many times do we use our elbow to open up? There's all sorts of little things that we do that just basically recognizing the fact that there are germs lurking in the air, on door handles, everywhere. So yes, our behavior, we just examine our own behavior. That's what the survey is showing for sure.
Yeah, I was at the airport at SFO last week and it was crowded. I walked in and just said, no, thanks. I'll find another one. So I think we are developing new habits, especially when it comes to the bathroom. I know you got a list of loo do's.
Yeah.
If you are going to use a public restroom and you kick it off for looking for a sign, what do you mean by that?
So you look at, there are many businesses and many of our customers, they take pride in looking after the restroom. If you're a restaurant, you're in business to provide great food, a great experience to your customers. You don't want your restroom to reflect the fact that, somebody might question what's happening in the kitchen, for example. So for us, the way we've always done it well before COVID is provided signs, a little sticker on a sink, on a urinal, on a toilet, where you flush, just to say this place has been sanitized and cleaned by Enviromaster, and it's a weekly program. And our brand has become quite recognizable now. We're national, including in Canada. So when people go around and they look at that sticker and they look at what the fixture looks like, it's shiny, it's clean, you get a sense of, okay, somebody's taking care over here. Okay, so that sign becomes quite important. We've expanded that to a much bigger sign. So one of the processes that we use in our weekly program is called the virus vaporizer gun. It's spraying the whole room with a hospital-grade germicide. And that with COVID, we've taken that service outside of the restroom, onto the tables, in classrooms, in industrial places. And for that, we provide a sign, a much bigger sign to say that this particular premises is protected because it's got a restroom hygiene program and a virus vaporizer program. So that sign is the first sense that a customer or a member of the public should look for to say, right, at least somebody's doing something on a regular basis to keep this place clean and sanitized.
Do you recommend people bring their own sanitizing wipes into a bathroom just to be sure?
It doesn't, for an emergency, of course. So fundamentally, washing your hands with soap and water is by far a most effective way of keeping it clean. Now, when are you going to ever, if you're next to a sink, yes, of course, that'll work. Now, the next thing is, what kind of paper products do you use? Are the paper towels just lying on the counter, or are they being dispensed? Because if they're lying on a counter, then what you're touching, you might have cleaned your hands, but this aerosol that's, when somebody flushes a toilet, all of that's lying on the paper, and all you're doing is putting it back on your hands. So having hand sanitizers in your bag, in your pocket, you get all of these in your car. I have it in the car. When I go to a gas station, I pump gas and I just, wipe my hands. So those kind of situations, of course, it's thoroughly recommended.
How about the hand dryer? You see those? I saw them at the airport the other day.
Yeah.
They're probably pretty dirty, I bet.
They are, and unfortunately, in our line of work, we tend to focus on areas where a public might not see, because we're trained to look for places where germs are lurking, where there's buildup and so on. And when you really look down into one of those hand dryers where you get the water droplets will sit there, some of them are pretty gross. Now, I know the hand dryers have some HEPA filters and so on that when they do blow the air, but actually what you're blowing onto your hands is air that's already circulating in the restroom. And as we've, the surveys also show that when you flush a toilet, these water droplets get ejected to up to between 6 and 20 feet, and they stay in the air for between 20 minutes to an hour. So if you're using a hand dryer, again, you've used water and soap, then you're just redepositing potential germs onto your hands.
I would imagine it's probably good to get in and out pretty quickly too. The less time you're in there, the less chance of getting
for sure
virus or something.
Exactly. Of course, if you see a sign from Enviromaster that says that this place is taken care of, then you have a little bit of comfort. Always wear your mask. That goes without saying. We should be wearing a mask, so masks do two things really. They're protecting you. If you have an N95 mask, that's protecting you. But if you're wearing any ordinary mask, you're protecting other people. So when you go into a restroom and there's water drops and so on, having some sort of a barrier is good for you. The less time you spend there, of course, the better it is, the less chance you have of catching any disease other than, let alone COVID.
And with that hand dryer in mind, I guess the least amount of things you touch is better too. I mean, there are some aerosol things that you might bump into, but handles, toilet flushers, the faucet, maybe get a paper towel to kind of not touch some of those things.
Exactly. So you don't always need automatic soap dispensers because when you first dispense soap into your hand, you may touch the dispenser, but then you're washing it away. Now the tap or the faucet would have could be contaminated. So before you shut the water off, you just take a piece of paper and you shut the water off and wipe your hands. You can use even and it's a good habit, because even if you have an Enviromaster sticker to say that this is sanitized, if you really want to be careful, then you use a piece of paper just to open the door and make sure you just dispose off the piece of paper correctly into a trash can as opposed to leaving it on the floor.
Yeah. I think we're developing good habits, though. I have not had a cold or anything since March, knock on wood. And, I got disinfected. I wear my mask, but I wasn't a big hand washer. And I think we're all becoming good hand washers now. And hopefully when COVID's down the road a little bit, we can all stay a little bit healthier.
Yeah, for sure. So Frank, here's the thing. Winter times are associated with flu. And they're more vulnerable people that have always had flu. And so Enviromaster, many of our customers actually have stepped up some of the services during the winter months. The real evidence that we have from our customers, so we look after kiddie schools, grocery stores, for example, and the evidence from the owners there is that even before COVID, that our processes, when we're going in each week doing a deep clean and using the virus vaporizer spray, this hospital grade germicide, which is food safe, they've noticed the level of sickness amongst their staff come down.
Oh, really?
Now, that's a huge, the cost of the service is insignificant compared to the savings that you get from staff not being there.
Well, that's a good point. You got a healthy crew, less days off.
Yeah.
That's a good point. I
Mm.
guess it's a good thing to talk about toilets because who knew there was a National
Yes.
Toilet Day, November the 19th, and some people may see this a day or two after, but happy National Toilet Day.
Well, it's a very, very serious topic if you think about it. I mean, I think it was the UN maybe designated it, what, 20 odd years ago.
Uh-huh.
And for very good reason, because half of the world does not have access to clean sanitary, facilities.
Right.
And the one sure way of trying to protect a population is to look after, to provide sanitary, facilities, and secondly, to where you do have them, to really look after them. And I think in the US, where Enviromaster fits in is that this isn't something that we just invented, yesterday. The company's been going 10 years, but our founder and CEO, Pat Swisher, he started this business 30 years ago. And he had an amazing foresight to say, well, let's focus on an area, the restroom, where it's an epicenter for disease and germs, and let's go in and try and kill the germs that might kill the business. So I knew nothing about toilets before we bought this franchise, and I absolutely loved the business model because it's a combination of the training that we give our technicians, how they are introducing themselves to the manager, to the owner each time, the processes and the training that we give them of how they use it consistently, whichever part of the country you might be in, and the solutions and germicides that are proprietary to us. And the combination of those three things simply enhances the restroom environment for the customer, the patrons, the staff.
Very good. Well, if people, Harminder, that would like to get in touch with Enviromaster in Sacramento or beyond, how do they do it?
Well, you Google us, you Google Enviromaster services in your area, and we have very well developed websites. You'll get directed to your local area. Our headquarters are in Charlotte, North Carolina. The guarantee that you get, that anybody gets, is that the service you get from one is going to be entirely consistent. And this is why we service people like Texas Roadhouse, for example. So whether in Sacramento or in San Francisco or in Houston or in Orlando, and you're going to use a Texas Roadhouse restaurant, you know that the service that restroom has got has been entirely consistent. So Google us, and you look at this. If you go to a place and you see a sticker, there's a phone number on it, call it.
All right. Well, some great insights on toilets and how to clean up our world a little bit. And hopefully we can get COVID in our rear view mirror, not Minder, that's you. Harminder Simi out of Sacramento with Enviro-Masters. Want to thank you very much for joining us here on Fox.
Well, thank you very much for having me, Frank. Have a great day. Our
pleasure. I'm Frank Mallicoat. If you'd like more information, you can go to newsnowfox.com. I'm Frank Mallicoat here in the Bay Area. Have a great day, everybody.